Okay, good morning, everyone. Welcome to our Wednesday morning COVID-19 briefing. I'm Carrie Schutte. I'm a spokesperson for the Shasta County Health and Human Services Agency. I'll start out with the numbers, and then I'll invite our healthcare partners to introduce themselves and then provide updates on what's gone on with them for the past couple of days since we saw you all last. Today we have 7 positive cases. We've got 236 negative tests. We've got 5 people in isolation and 22 in quarantine. I would love to introduce our healthcare partners. Can we start with Shasta Regional, please?
Good morning, guys. My name is Mark Mitchelson. I'm the Chief Nursing Officer here at Shasta Regional. And for updates for us, we just continue to follow our revised visitor policy. We're checking all employees at the front lobby for any signs of fevers or screenings, and just working with public health and the CDC to follow all the ever-evolving recommendations from them.
All right, thank you very much. Mr. Germano, Shasta Community Health Center.
Good morning, Dean Germano, Shasta Community Health Center. Yes, we're doing much the same. We're screening all patients coming to our doors, doing temperature checks, doing a lot of phone visits, and trying to manage patients as best we can from a distance. We are anxiously awaiting some testing capacity that's coming out, we hope soon, that would help in some circumstances, but we're doing the best we can.
Great, thank you. And Mercy Medical Center.
Hi, my name is Allison McHugh. I'm the Chief Nursing Officer here at Mercy Medical Center in Reading. And we continue to fine-tune our surge plan. If we were to receive any increase in patients, every day we evaluate that and we fine-tune it. We meet every morning and we have a small group of us that meet and we go over that every day based on information that we receive. I feel very confident in our staff that they are prepared, and we continue to monitor our use of personal protective equipment on a daily basis as well. As part of that surge plan, we continue to monitor our visitor restriction that we have in place. And we also have a very robust plan for our staff being ready to cross-train. Cross-training has always been something that's been part of our careers, but people are learning new ways of being flexible and really stepping up. And it just makes me proud, not only to be a nurse, but to be a healthcare professional, because we train for this our whole careers, and people are really putting that into action. I feel very, very confident in our staff and being able to keep the hospital and the community safe.
Awesome. Thank you very much for that. We also have Peter Griggs from Shasta College, who's available to answer any questions anybody has about the college. And then Brandy Isola.
Good morning, everyone. I'm Brandy Isola. I'm the Public Health Branch Director, and the Public Health Department is really ramping up our efforts to contain the increased number of cases that we've been getting reports on, and we anticipate that to increase over time. And so we are looking at our Department Operations Center and looking at how we can make ourselves as nimble and flexible as possible to respond to positives. And we continue to work with the community to encourage following the governor's stay-at-home orders.
Great, thank you, Brandy, and thank you for joining us from, it looks like you're multi-meeting attending this morning, so we appreciate you being here. And then Dr. Ramstrom.
Good morning, everybody. So as was shared earlier, so we have 7 cases now in Shasta County, and I think it just provides a good opportunity for us to reinforce the messages that we've been sharing with all of you. It makes them a little bit more real, actually, as we look at each of these individual situations and just recognizing how hard it is and what a shift in the way that we just live our lives daily in terms of the amount of interaction that we have and how we're a very mobile community. And so just a reminder that can make a big difference in our community if we all do our best to stay home, limiting contact with others, really just going out if we have to do essential work or to meet our basic needs. And just some specifics around that too. So, we think about, and we're trying to keep our older adults and individuals with medical conditions at home, and they're relying on neighbors and friends and family to provide them supports. And so I think it's really a reminder to all of us that if we're in those supportive roles, which is really important and I'm sure is very much appreciated, is that we ought to be really, really diligent with being really self-aware about any symptoms we might have, anybody we might have come in contact to that might actually put those individuals that we're coming to care for at risk. And so just a reminder about that. We don't know how this is going to progress. And I think we're learning nationwide, and it's been recognized what a difference this statewide order is making. And we are recognizing that it's hard for a variety of types of situations to comply with that recommendation and that order from the governor. But it can really have a big impact. And just a reminder, one of the main reasons we're doing that is to try and slow transmission in our community so we do not overwhelm our healthcare system to the point where they don't have the capacity to take care of all of us because the numbers go up so quickly. And so thank you for everybody for being diligent and doing your part. And we all have a role. And thanks for tuning in.
All right, thank you, Dr. Ramstrom. All of the questions that I received ahead of time were asked by reporters who we're lucky enough to have here with us today. So I will ask none of those questions. I'll let all of you ask them instead, and we are ready for your questions right now.
Hi, everyone. This is Karen from Action News Now. Do you guys hear me okay?
Yes.
Okay, perfect. Just regarding the military field hospital, I know, just to reiterate maybe some information, what are the possible sites being looked at, and has a site been chosen? I know there was talks of a military field hospital coming here to Reading.
So this is Karen. I can try and address that. So it's still in the works. We were really fortunate that our state health department put in an order early to try and get some federal support. And so Shasta County is on the list, and we were looking at our region in terms of our healthcare delivery system and kind of where people go in terms of that system and from the surrounding community. And so we're continuing to develop those partnerships and waiting to hear back from the federal government about for sure that we're going to receive that and when, and hope we're anticipating it will be within the next week or so or two, if that's going to happen. And they have to approve the site. And so that's all still in the works.
Other questions?
Hello, I've got a request and a question.
Okay.
Could everybody who is not speaking mute their microphones, because I'm recording this and you keep popping up. I keep getting pictures of people popping up all the time when the microphone hears sound.
Yes,
thank you.
We will do that.
Thank you. So, and then I have a question for Allison at Mercy. Hi, Allison. I would like to ask you, what is cross-training? What is that? What does it mean?
Sure. This is Allison McHugh, Chief Nursing Officer at Mercy Reading. Cross-training is really taking a look at all of our staff and what their current skill mix is, what their past experience has been, and then we're looking at areas that we may need to have increased specialty. So whether it's in the emergency department or intensive care, respiratory therapy, skills that might be augmented in looking at new ways that maybe in the past we used to do, whether it be, team nursing and all of us working together to use all of our skill sets. So coming up with a list of things that we know are key skills that many of us used to do many years ago, and maybe we just need to brush them off, or some new skills that maybe we haven't yet learned, but we're training people within the upcoming weeks to kind of fine tune those.
Could you give me an example?
Sure. So we have nurses who might work in, let's just say, a post-anesthesia, a PACU nurse who in the past might have been a critical care nurse. And they have skills that might have been used in an intensive care unit, including working with a patient on a ventilator. So we have training that we're putting in place to make them even more comfortable, because it might have been a few years since they've cared for a patient on a ventilator, and not that they would be solely caring for that patient, but in an event that they may need to step into a critical care situation, that we'd be able to have them be part of our resource pool.
Thank you.
Thank you.
I guess this is just another question more regarding more of the field hospital, since this is what I'm kind of working on today. Does this mean that our hospitals have reached their max capacity, or is this just more extra help? What counties will it serve? How many counties will it serve? And then how many, I know you said it's still too early to tell, but still in the works, how many beds will this field hospital be equipped with? Any details would help.
Sure. So I can share what I know. Again, it's still yet to be finalized and approved. So it's a field medical station that comes with a certain number of beds and supplies. And the discussions that are happening right now is looking at how that could be shared between Shasta County and Butte County. The idea is to make sure that we are disseminating some of those resources so that we can kind of share the distribution of patients and not have those all come into an area where it looks like there's more capacity. And so how that will be used and what it will look like is still in development, and will involve a lot of conversations that still are in the works with the hospitals, because we really need to hear from them what they anticipate their needs are and how this federal asset could actually help them to take care of these COVID patients. And, you know, whether that would be, you know, trying to get healthier non-COVID patients into these beds outside of the hospital, or what that might involve. And so it's part of surge planning. And so hospitals, as was described, they're doing a lot of work in that area and already have a good sense about their capacity. And this is, we're super fortunate to have this available in our North State, so that we have this little bit of cushion. And, you know, should we need it, we'll have it available. And those plans are still in the works.
And will it be just treating specifically COVID patients, or also just non-COVID?
Yeah, like I said, all of that's still in development and needs to be finalized with the hospitals and discussions.
All righty, thank you.
Yes, for sure. RV, you're back on mute. We can't hear you.
Yeah, I guess don't touch your face on the phone. You hear me now?
Yes, we can.
You can hear me now. Okay, good. Yeah, my first question concerns mask use. Yeah, there's sort of a growing consensus across the country that maybe the general public should also be wearing mask use, wearing like a surgical mask or an N95 when they go out on their little essential runs. And I wanted to see what Shasta County's opinion on that matter was.
Yeah, I can address that. It's a great question. I think we're in this place where we're looking at all options. You know, the more of these mitigation measures you can layer on top of each other, the more successful we're going to be. I think if we had all of our dreams come true and we had a vast supply of surgical masks, we would have every resident have one and wear them, like you said, when they're going out to do those, have their basic needs met or meeting essential functions. So, but unfortunately we don't, and we actually have to make sure, as we talked about before, that we have supplies available for our healthcare providers to keep them safe as they're taking care of all of us. And so the idea is, are there other ways to have masks available that are not, the kind that are approved through those more formal channels for medical use? And so whether they're homemade or, some innovative company comes along and they make some.
Yeah, there's a big DIY thing going on right now.
Yeah, right. And so I think my main concern here, and that we've been talking about internally and doing some work on, is that we have to make sure that the users know that that does not replace social distancing. All it does is add another layer of protection to the people around that individual, so that you're not, sharing your potentially, early symptoms and virus spread with the other people around you. And so we need to make sure that if we implement that broadly, and we actually have entities making those available, and we do, that we actually have some good education for the public to be able to use those safely in a manner that's going to protect them and to help them to be safer and not cause more harm.
Great. My second area question has to do with the testing that's been done so far. It sounds like we've done about 250 tests. And I wondered if you could maybe give a percentage of those tests that are contact tracing. Have you been able to do a lot of contact tracing so far?
So we have done a lot of contact tracing, and contact tracing doesn't always involve testing. It involves identifying close contacts and implementing isolation or quarantine orders for those individuals. They are symptomatic and they're a close contact. If we have the capacity here at the Public Health Lab, we will test them. So some of those tests that you just quantified have been for those situations.
Mm-hmm.
But a lot of the time, those individuals are in quarantine and monitoring for symptoms. If they don't develop symptoms, there's no indication to test them. As we are having limited supplies at our Public Health Lab and our back order on some of the supplies that we need to run our tests, we're being really, really judicious in what we're using our tests for. And so, we're kind of doing that on a case-by-case basis right now.
Right. Would you say that most of the people that have been tested are sick people that have all the symptoms?
I'd say the vast majority of the people who've been tested at our Public Health Lab are hospitalized patients, a great majority of them. Then we also have a few close contacts that are symptomatic, like you mentioned.
Mm-hmm.
And then the commercial lab, I can't speak to. It'll be interesting, as we don't really get a lot of those details unless it's obviously unless it's a positive, and then we'll have more details from the healthcare provider about that.
I was curious about that because I heard you mention that before. Is it possible to get the total number of tests the commercial labs are done? I understand they might be facing the same kind of shortages as you are.
So I think today it was about 92 that we've received reports on, but I'm sure there are many additional tests that have yet to be run that have been sent to commercial labs that have yet to come in.
That's 92 in excess of the 250?
No, it's included.
Oh, it's included. Okay, good. I wanted to know that.
Yep.
I think that's all my questions.
Can you guys hear me?
Yes.
Okay, this is Elena Schulman with the Record Searchlight. Hello. One thing I've been hoping to get addressed is if you guys have like a forecast for, nationally and statewide. It seems like we're seeing predictions of like local peaks or non-local, but as far as for Shasta County, are you guys looking at thinking a certain week or any time would be like when we have our highest incidence of this illness? Oops, I think you're muted, or is that me? Somebody's muted. I'm not muted.
We're planning to, we're working on that right now, Elena, on forecasting. We're hoping to have that for you hopefully by early next week at the latest.
Okay. And then are you guys, I don't know if this is something you could address, but just I'm guessing you're aware that an employee of the veterans home is tested positive. Do you know if that person is among the 7? There was something that the vets home sent out that made it a little confusing.
So anytime we have a confirmed case, it's in our numbers that we report to you all.
Okay. And then just the other thing I was going to ask is, let's see here, where did I write that down? Now this, obviously yesterday we were talking about the first community spread, and then the 7th case, it looks as though she was a close contact of the man who contracted the illness via community spread, if I'm understanding that correctly. So I was just curious if you guys could address again that the fact that that's arrived, and that in this case, now there's not only is one person infected seemingly at random, but then somebody he's close to has it. It seems like it's a strong indicator of the need to take those measures seriously.
I guess I can address that. So you're absolutely right. And so close contacts we know are not uncommon. So we are not surprised that a close contact was identified. It happened to be that close contact was with the individual that we were not able to identify another source. And so you are spot on that now this is an indication that we have some transmission in our community that we're not able to identify. Why these prevention measures are in place, right? That we don't have the capacity, unfortunately, to test every single individual and to identify every single case. And so we have these other mitigation measures in place, which include, staying at home unless you need to go out and meet your basic needs, and not congregating, even if you actually are, a worker in an essential infrastructure job. That you still want to maintain 6 feet and frequent hand washing, and limit the amount of that you can, even if you can do distance working, then implement that within the way that you get your work done. And so all of those things are still recommended. And as you said, this is a perfect time to be reminded that why we're recommending that, and why it's so important to do that now, to slow it down, because we know it's in the community, and the less we have contact with each other, the less that virus can spread.
Yeah. Okay. And then the only other thing I was going to ask is, can you, Carrie, I know yesterday you and I talked about this a bit, but can you guys address just a little more the whole testing shortage or components of the tests that, I don't know if you have any more like specifics nailed down beyond just that there is a shortage, like how much and whether and when you're expecting to get more, that sort of thing.
Yes. So, it's a real challenge. So in our public health lab, what we do not have are what's called extraction kits. And that's what's used to extract the what you test for in the actual test kit. So you have to extract from the specimen itself before the specimen. And so that's what is back ordered. Hoping to have a supply next week, but we don't know. We thought it would be, we would have already received that. And so we're competing with other labs that are also ordering that. Yeah. We know that some other county public health labs have also run out and are not able to test it all now.
Wow. Okay.
So it's a real problem. And we're doing our best to kind of preserve some number of our tests for urgent needs. So for example, say we had something of concern in the jail. We want fast turnaround on that. So because if we had a case there, it would be a big problem. Yeah. So we are prioritizing what we're using our tests for. And luckily we do have commercial testing available, even though that capacity is still not what we would like it to be, but it's there. There are some other tests that have come along that we are also exploring. One that was just FDA approved this week that is a point of care test. So we're kind of looking into how do you get on that list to get order demands. There are other approved tests that are actually going to be available to such as at our one of our hospitals, and hopefully that will be coming soon. But again, it's a matter of when that company can get those supplies out, and sort of all of that is sort of up in the air right now, but hopefully soon. There are a variety of other tests that are out there that are not yet FDA approved, and so we're hoping that more will come.
Okay. And then do you have a specific number? Like, I know Carrie, again, you and I talked about this a bit, but I was just curious, is there indeed a specific number of like, we have, 100 tests or anything like that, or the ability to test that many people at least, whether it's components or?
Right. So we have far more tests. We have the ability to patients to test just because of the extraction kits. So right now it's probably after today, it'll be somewhere probably in the mid 40s or so.
40 or so tests after today. Okay.
Patients that we can test.
Or excuse me. Yeah. Patients.
Mm-hmm.
Okay. Okay. Well, I think that's all I had for now. So thank you guys.
Hey there. I listened to Governor Newsom's press conference this week, and he talked a lot about the surge in needing healthcare workers. And they even have a website where retired healthcare professionals, pharmacists, doctors, nurses can apply to work. So I guess this question is for the hospitals. And how sufficient is your staffing capability right now? And do you see that if there was a surge that you would need to draw upon people like from the state level? I don't even know how they would, do you see people coming from the outside to help in the event there is a surge?
Sure, I can take that one. So for Shasta Regional, because of the stay-at-home orders that have been going on and the reduction of elective cases that we've done proactively, we've actually seen a significant drop in our total census for the hospital. So, which has allowed us to be able to be flexible with cross-training staff, similar to what Allison was saying about Mercy. So we actually currently have significant capacity if there is a wave. But if there is such a wave that occurs that would exceed our capacity, we would reach out to public health. And I know there's a lot of collaboration between the two, so we would reach those resources prior to ever needing them.
Yeah, and this is Allison McHugh from Mercy Medical Center. Similarly, we have a process that we're following, which actually does include retired nurses. We have a team of people in our incident command that's actually dedicated to what we call the people work stream, and looking at making actual phone calls to retired nurses and putting them on a list in the event that we did need to go to that level. Part of that list also includes volunteers who may or may not be students who might want to come help us. So we're absolutely open to other volunteer healthcare workers if we were to exceed the number that we have available.
This is Dean. I would just add that, remember those field hospitals? I think the governor was really pushing because they're trying to create 50,000 beds across California, new beds, and they need workforce for that as well. So we shouldn't forget that depending on the size and complexity of our own field hospital, we will need help for that as well.
So in other words, you think maybe our hospitals have sufficient supply in terms of staff, but with the field hospital, do you think it might be necessary to bring in outside help, or does the North State have enough people here from which to draw?
Yeah, this is Allison McHugh from Mercy Reading. I feel confident in the amount of people that we have in our hospital today, plus the other venues that we discussed regarding volunteers, retired nurses, students, and if we were to need to tap into our sister hospitals, that is also part of our plan as well. So I do feel a partnership, obviously, with the Army Hospital, if that was needing to be opened, so that we could collaborate on making sure that both are taken care of.
There's many unknowns here, and I would just say that if by horrible chance the virus gets into our workforce, then in our hospitals and our healthcare providers, that is that could change the metrics considerably. So I think we're all building up our inventory of resources, both people and other assets. and hope that through our mitigation efforts that we don't have to go down that road. But yeah, I think we're all calling upon connecting up with our retirees, our students and others to be in reserve in case we need them.
All right, other questions?
Well, I'll follow up, but kind of even on, yes, a personal note. My daughter is in her final semester of nursing school and can't finish because she can't get her clinicals. Will it take like an emergency situation for those students to be able to get into the hospital, or is there a way to do that? Because she's ready, willing, and pretty much able to go to work.
Yeah, this is Allison. We do actually have, again, as part of our people work stream, students are on that list. And so I would ask that you send her to our human resources department, and I can talk a little bit more about, we have actually a group that has a way that we're having people send in, you know, if they're interested in coming and helping us. And that group is kind of formalizing what that process will look like. But we absolutely, if we got to that point, because again, to Mark's point right now, we're okay. But the list is really, if we were to get to that place, that we'd want to have them on a standby list. So more to come on formalizing how to actually send in their names. But our group is working on formalizing that.
Thank you.
Other questions?
I have a quick one. I was glad to see, Peter, that you're here today from Shasta College. And I understand that it's a kind of a sensitive area about specific people and details about them and their lives. But the young woman who was a Shasta College student, I'm just wondering if she was by any chance a student at the health center, or if there are any concerns the public should have about maybe having been exposed to her when she was asymptomatic.
Right. Hi, this is Peter Greeks with Shasta College. Thanks for the question. The young lady in question was a student at our Health Science University Center downtown. At this point, we're working with public health to identify those who might have come in contact with her. But no, I would say the public should not have any additional concern at this point. It would be primarily her, the classmates and people that she was close to within the lecture and labs.
So, Peter, she was not working on patients?
That'd be a question that I would again direct to public health. I don't have that information for you at this time.
Yeah, this is Dr. Ramstrom. So I would just say that, you know, in all of these circumstances, we are identifying close contacts and reaching out to those individuals to make sure that they're informed and quarantining or isolating as indicated. And so we would have identified those individuals.
Thank you to both of you. Are there any other questions?
Sure, I had a question. This is Damon Arthur.
Hi, Damon.
Hi, this is Damon Arthur from the Record Searchlight. I was wondering, I know that public health is trying to reach out to businesses, retail businesses, and restaurants, and an educational focus regarding the governor's orders to close down except for essential businesses. And I was wondering if there are any of them that have progressed to the point where you've had to have law enforcement go out and speak to any of those businesses or restaurants, and how many that may be. Thank you.
That is probably a Brandy question, and I think she had to disconnect from us. I know that cases are referred to law enforcement after they've gone through several steps with us, where we start with educating, making sure that people are aware of the essential business order that the governor has set forth, and then if it does not resolve itself, that that we do refer to law enforcement. I don't know how many have been referred at this time. Dr. Ramstrom, do you have any additional information on that?
As far as I know, we haven't had to refer any to law enforcement yet, but it's an ongoing effort, and I think that the process will evolve. We're really working really closely just with a lot of questions from businesses who are trying to do the right thing. But we have set up this process that Carrie just described, where we hear about a concern that we're doing education, and we'll do a series of education before we would engage law enforcement. And really just trying to work with those businesses to comply.
We definitely understand the strain that our small businesses are feeling during this time. It's very real, a very real challenge for them. We have a few questions from Facebook. The first one is to our hospital folks. Are employees notified if they are exposed to an asymptomatic patient who then tests positive while in the facility?
So go ahead, Mark. I was just going to ask you to repeat the question.
Oh, of course. They are interested to know if employees are notified if they have been exposed to an asymptomatic patient who then later tests positive while in the facility.
Okay. I can help if that would be useful. Yeah, and I think that we're trying to do this in really close coordination with the hospitals too. So right now, I think what you're alluding to is right now the guidance is, so we would hear about that once their test comes in and it's positive. That's how we would first learn about it. And then we would begin our contact tracing. Right now, the guidance is around really starting that at the time of their symptom onset. Whether that guidance gets changed by the CDC to include a pre-symptomatic period of time, we're waiting to see, but we're also having that right now as we're doing our contact tracing and having a conservative approach to who we notify. And so if it happened to be somebody in an employee in a healthcare setting, we would be working very closely with that healthcare entity to notify who needed to be notified and address the needs of their employees.
Great, thank you, Dr. Ramstrom. Any other questions from our media? I was remiss in failing to share that Valerie Lakey from Mayor's had another meeting today, but she wanted to let everyone know that they're still working with county partners to be prepared, evaluating their processes and implementing policies to keep residents of their skilled nursing facility healthy and safe. They've been communicating with residents, families, and also updating their webpage, which can be accessed through the shastaready.org webpage. And that's what they've got new going on. I apologize for the delay on that. All right, does anybody have any last questions for our healthcare professionals? All right, I know we have some questions on our Facebook live stream that my staff will work diligently to get answers to. And we will, as we've been doing this week, we'll be putting out a written update from all of our partners tomorrow on our Facebook page at 11 a.m. And then we'll be back live like this again on Friday at 11 a.m. Thank you very much to all of you for participating. We appreciate you taking your time to help our community understand what's going on. Everybody have a great day.
Thank you. You too.
Thank you.
Thank you.